Alright, once again, this is Dr. Ed. We are going to look at the second part of the abdominal scanning protocol. Hopefully you watched part 1, which was presenting the liver and the gallbladder ultrasonography. And so today we are going to look at abdominal great vessels, the pancreas and the spleen. You know, with a protocol it is better if you follow order, and so if you haven't watched part 1, please go start with part 1 then come to part 2 so that you understand everything. Alright, so we're going to start with abdominal great vessels. We can see the abdominal aorta all the way from the diaphragm up to the level of its bifurcation into common iliac arteries. Still, we can see the inferior vena cava still from its cava aperture up to the level of the common iliac veins. So these are the tributaries, whereas the aorta has these branches, which we are going to see in details. Okay, still on this sonogram, we can see the inferior vena cava, and then we can see the abdominal aorta with these branches, whereas we can see this tributary from the liver. Most likely this is hepatic vein. Alright, so we are going to start with the abdominal aorta. As you know that structures we have to scan in both sagittal and transverse. So this is a sagittal view of the abdominal aorta, showing these two main branches, the celiac trunk and the superior mesenteric artery. So for the aorta, we know that it is a tubular straight structure with thick walls, which are echogenic, hyperechoic. Then posterior, it lies posterior to the liver. We can see this is the liver, so it is posterior to the liver. When you're scanning from the midline, it lies slightly to the left of the spine, so it is incompressible, doesn't vary with respirations, it is pulsatile, and when you go to a transverse image, it appears as a circular anechoic structure. So measurements, it measures mostly before giving these branches, it measures 3 centimeters and less. So before or after giving up or giving out these anterior branches. So after it measures 2.5 centimeters, whereas immediately before it bifurcates into the common iliac arteries, it measures around 2.0 centimeters. So in this sonogram, we can see this is the celiac trunk, which goes and gives out to hepatic artery and splenic artery. Whereas this image, you can see the aorta giving out to the right renal artery and the left renal artery. Alright, whereas this hyperechogenic walled structure is the superior mesenteric artery. For these other structures, we shall see as we continue. Alright, so with the aorta still, we can see the tubular structure reaching at this level, then giving out to these two branches. So this is the aorta bifurcating into the left and right common iliac arteries. Okay, so before bifurcating, that measurement is taken at this level, which shouldn't exceed 2.0 centimeters. Alright, so what of the inferior vena cava? So in sagittal, this is how it appears. It is hammock shaped. Here we can see when it's curving to power into the right atrium, whereas it traverses through the liver. So we shall have part of the liver lying anteriorly, whereas some part of the liver lying posterior to it. The walls are thinner compared to the aorta and less echogenic. So with respirations there is some variation, then it can be compressed on real-time scanning. So it has tributaries, which are the first ones being the hepatic veins. Then it appears oval on transverse view. So these are the hepatic veins entering to the IVC or joining the IVC. Then here we can see the IVC appearing oval. Okay, so this is the portal confluence, which is given by vessels, the splenic vein and the superior mesenteric vein. Okay, whereas we can see this the left renal vein, whereas the right one is always here. So to the left lies the aorta. Alright, so that was the inferior vena cava. So still we can continue with this pancreas. So this image we can see this yellow painted image. This is the pancreas. This is the head. You can see the neck, the body, and the tail. Okay, this is showing us the biliary tract with the pancreas. So we can see the hepatic ducts, can see the gallbladder, then the cystic duct forming the common bile duct, which goes and through the pancreas, then powers its secretions into the duodenum around the sphincter of Oddi. So there it's also the pancreatic duct still joins the GIT. Therefore, this is the pancreas which we are going to see. Alright, so sonographically the pancreas still it is scanned in both sagittal and transverse. So we're going to start with the transverse view. The landmarks, you shouldn't forget that this is the aorta. Then right to it we have this is the inferior vena cava. So anterior to the inferior vena cava we shall be having the pancreatic head, which shouldn't exceed 3 centimeters. Then we have this portal confluence. Posterior to it we have the uncinate process, you can see here. Then anterior to it we have the pancreatic neck. Then at the level of the aorta, anterior we have the superior mesenteric artery. So anterior to it we have the pancreatic body. So when you continue with the splenic vein, anterior to it we have the pancreatic tail. For the measurements, for the head shouldn't exceed 3 centimeters, whereas the neck shouldn't exceed 2.5. The body also shouldn't exceed 2.5 centimeters, as well as the tail. Alright, so for the pancreatic duct, so hard to see, but it is always seen shouldn't exceed 2 millimeters in its diameter. Okay, so that was a transverse image. What of now a sagittal view of the pancreas? It is unfortunate that you cannot have it all in this one view, but because of that we do get part of it by part. So starting with the pancreatic head, our landmarks are always the IVC and the portal confluence. So inferiorly, slightly inferior to the portal confluence and anterior to the IVC, we do get the pancreatic head, where there is our letter P. Okay, and then what of for the neck? To get the neck, what you do, you just open the portal confluence, and we shall have a straight superior mesenteric vein. Then posterior to it we shall be having the uncinate process, whereas anterior to it we shall be having the neck and part of the body. So to visualize the body very well, you use the aorta as a landmark, then you locate the celiac trunk and the superior mesenteric artery, they are always pointing to the body of the pancreas, as we can see. Then for you to have the pancreatic tail, what you do, you just get the other view of the body, and you just angle your transducer towards the left shoulder, and you'll get this very image. You'll get the splenic artery and vein, then anterior to them you'll have the pancreatic tail. Wow. Alright, so as we continue, we're going to see the spleen. So for the spleen, we all know that it's that organ which is shaped like half moon, and then it is located in the left hypochondriac region. So you can see it, this is the spleen, and also sonographically this is the spleen. Okay, so this is a transverse view of the spleen. This is at the level of the hilum, but let us see it very well. So for the spleen, you'll be having like this image, kind of semilunar. Then it has two pores. This is the superior pole, which is adjacent to this, the diaphragm. Then this is the superior pole, whereas this is the inferior pole. At this level, you'll be having the hilum. So you can measure from the upper pole to the lower pole, which shouldn't exceed 13 centimeters. So when you turn around 60 degrees, that's when you get a transverse view of the spleen. Whereas from the hilum to the outer part of it, you do get the diameter, which shouldn't exceed 6 centimeters. Alright, so still at this level, you can compare the echogenicities for the spleen and the left kidney. You have to get like this very image. So the spleen is always less echogenic compared to the renal capsule, whereas it is hyperechoic comparing it with the renal medulla and the renal cortex. And definitely it is hypoechogenic in comparison with the renal sinuses. Alright, so that's all I had for now. Okay, thank you for listening. But still, I still tell you to watch part 3, which is coming, and it's going to be the urinary bladder, the urinary system, definitely, the kidneys, the ureter, and the urinary bladder. So remember to like and subscribe to my channel. Thank you for watching. Alright.